Hey everybody, for my final project I decided to do a study on WHO, and you all might be wondering who is who. And WHO stands for World Health Organization, which is a specialized agency of the United Nations that is concerned with our international public health. They strive to build a healthier future for people by combating disease and other health threats across the world. They came into existence on April 7th, 1948, and their headquarters is currently in Geneva, Switzerland. And they currently deal with over 194 member states. Before I show you a short video published by WHO, I will try to explain a little bit more of what they do. They are concerned with trying to move forward universal health care coverage, which will be the bulk of our discussion today, striving to have evidence-based policy making based on hard scientific evidence concerning our health and moving toward more affordable health care. They also assess environmental and social impacts on health and communicable diseases such as AIDS and malaria. And that includes prevention such as mosquito nets, etc., response, and also treatment options for those affected. They also aid in coordinating response to natural disasters if they're going to impact the health of individuals in those nations. And with that being said, here's a brief video summarizing the World Health Organization's goals and initiatives.
The world is rapidly changing. It is home to 800 million more people than a decade ago. More people live in cities and travel than ever before. With many new partners working on global health, political leaders are realizing that health is essential for people and countries to reach their full potential. And that's why the World Health Organization works to make sure that everyone, wherever they live, has access to medicines and essential health services when they need them. Based on research, WHO sets standards and makes recommendations that protect people as they grow, live, work, and age. It's all linked. Enable children to survive and reach their full potential. Ensure their mothers have healthy pregnancies and can continue to contribute to society. To ensure people enjoy longer, healthier, and more productive lives, we find new and better approaches and then work hard to put innovation into action. We've seen results. HIV mortality has been cut in half from 2005 to 2015. Measles vaccines have prevented more than 20 million child deaths since 2000. WHO is assisting more countries to move towards providing universal health coverage so that everyone has access to affordable health services. But there's still a lot of work to be done, whether it's rapid response to an epidemic or cultivating local partnerships with people on the ground. WHO is a driving force for a healthier world, boosting the trajectory of lives saved and laying the foundation for better health for all. Solutions for a healthy world, for everyone, everywhere. WHO stands as the guardian of health.
Hopefully that video was a good summary of y'all for the World Health Organization's specific initiatives and kind of how they're put together. One of the specific initiatives that we're going to talk about today is universal health coverage. So what does universal health coverage mean? It means all people everywhere should have access to the health services they need without fear of financial burden or being pushed into poverty due to costs of those services. So it's the equal access to quality services of healthcare without financial risk. And how do we achieve this? There are certain ways that this can be achieved, but it's a bunch of working parts that all need to seamlessly fit together. A well-run, efficient health system that meets needs through a person-centered care instead of profit-centered care. We need affordable medications and machinery and supplies, affordable labor. We need skilled labor, well-trained doctors and nurses that can provide adequate and safe care for those who need it. A key element is finance sharing is very important to achieving universal health coverage for all, and we need to look at this with the realization that providing this coverage will prevent costs of widespread epidemics across populations. Measuring the success of universal healthcare programs is very difficult. Some of the studies that have been conducted have used the percentage of people able to obtain the health services that they need versus the number of people pushed into poverty due to medical expenses. There are several impacts of universal health care. There's obviously health benefits, improved population health, especially in poorer communities that wouldn't have had access to certain medications and certain levels of care prior to this implementation. Economic benefits, it enables people to be more productive, go to work because they're not getting sick as much. Financial risk protection prevents people from being pushed into poverty, and there's also less out-of-pocket spending from the general public, so that's more money that they can put back into the economy. Political benefits, there weren't any real specific benefits listed, but they did mention that any of these initiatives and reform need to be very carefully thought out and implemented so that they can stay in place despite political party changes or changes in the future. And insufficient coverage of health services definitely impacts human rights. And when we think of coverage, we need to think of all citizens, not just as a population of Georgia, but also the people in Georgia that live out in the sticks with no electricity. The coverage that they're thinking of is they do want people to have options of different coverage levels, but not have priority to services based on that coverage. So for their policy making, the World Health Organization uses evidence-based policy making, which I think is really important, especially in making decisions about our health. They have implemented a knowledge transition platform, which was implemented in 2005 to promote systematic use of evidence-based research and policymaking. The system promotes sustainable partnerships between countries in policymaking and researchers to facilitate policy development and implementation through the use of scientific evidence instead of just kind of not having anything to base it on and a bunch of people in the room just arguing with each other. In 2007, the WHO released People-Centered Healthcare Policy Framework, which include a comprehensive list providing member states with a list of evidence-based policy measures that can be utilized in placing people at the center of their healthcare systems instead of profit. Member states may adopt an appropriate mix of the reforms and interventions based on their own unique needs and circumstances. So I have made a handout with a couple graphs and everything and a few more videos and sites, but hopefully this video was a good summary of the World Health Organization and how they are working to implement universal health coverage internationally. Have a good semester!